life before was really hard because pain is very debilitating. Everything that you do, you need your legs, your knees to stand, to walk, to cook, to do anything really. And with having that pain, and it was a lot of pain, that's all you really think about during the day. So it really, really is debilitating, and it consumes your whole life. It just, that's all you think about. And I'm sure my family's sick of me. They got sick of me complaining, so I figured I better do something about it. I mainly came in here for my knees. I have osteoarthritis, and I had it for about 5 years before I came here. And I have other things going on too, like my neck and my back, but mainly my knees. And I could barely, it got to the point where I could barely walk from my bedroom to my kitchen. And that's when I knew I had to do something. And I knew I didn't want knee surgery. And so I did a little research and found Golden State Medical. And that is truly the best decision I ever made, because now I can walk and I'm, pain-free just about. I mean, it's like day and night for me, so it's amazing. I tried not to go out because I was in pain. And so that was a big factor, to not be able to go shopping or playing with the grandkids. They're used to me. I'm a hands-on grandma, and they're used to me getting down on the ground and playing with them. I couldn't do any of that. And just, going out in general, I stayed home. I just stayed home all the time. And I babysit the grandkids. And my son, I don't have stairs where I live, but my son have these massive stairs in his home, and I would have to go up them sideways and hold on, and the grandkids would always try to outrun me, which they did very easily, but I could barely go up the stairs, and I tried to just go up there when I had to. So that has really helped, because now I can go up and down the stairs with no problem. I tried a lot of topical treatments, Salon Paws, and just anything, any kind of cream I could get my hands on, and aspirin, Aleve, ibuprofen, and they actually made me sick, and I was told not to use them. Tylenol was about the only thing that I could use, but I would go through a whole bottle in no time, and I just didn't like doing that. Knee braces, I used to wear those too. They were the kind that you just pull on, and at first it felt good, but then after, they started to hurt a lot, and so I wouldn't wear them. And the knee braces that I have now, I put them on, and immediately it takes the stress off of my knees. I can just feel the weight come off of my knees, and I'm able to be more flexible and walk more and go out and go shopping and do things that I couldn't do before. And the braces are amazing. They really are. It just, as soon as I put them on, I feel better automatically. Definitely, I've seen a dramatic improvement in my knees. I would say about 75 to 80% improvement between the pain and just overall movement and things that I'm able to do now versus when I just came here. And I can go shopping. I can play with the grandkids, which is very important to me. Before, I hadn't walked, because I used to walk 2 miles every day. And so I stopped that. I hadn't walked for over a year, and now I'm back walking. And I've almost got it up to a mile, but I was told to do it gradually, although I come home and I go, I could probably have done more. But that's big for me. and just being able to kind of get my life back, because I felt like I was just sitting at home between COVID and my knees. I was becoming a hermit, and now I really feel like I have my life back. They have good reviews, and I am familiar with San Ramon, even though I live in Brentwood. And I feel that this was a real viable option because I'm a Kaiser patient. And when I went to Kaiser, at first they just told me to take meds. And then when it got really bad and I went back and they go, okay, you're a candidate for double knee surgery. And I didn't want to do that because I heard bad things about it. I know some people that it just didn't take when they were like disabled for a long time. They couldn't get their life back. And I thought, well, I can't do that. And I can only do one knee at a time. I have to take care of my grandkids. So I was looking around for another option. And I'm glad I did because this gave me exactly what I needed. I got to take care of both knees, not just one at a time, but both knees. And I feel great. I mean, I know I wouldn't have felt this good by having the knee replacement at Kaiser. Because I have a cousin that had a knee replacement and she needs to do her left knee, and she said she will never do it. And so I thought it's worth a try. So that's what I did, and I'm really glad that I did. I was always in good care here. The staff was truly concerned about how I was doing. I wasn't, they don't just treat their patients like they're just a herd of cattle coming in and out. They really do care. And they care about each other. They've created a really nice atmosphere. It's very, when you walk in, you feel very welcomed, and they get along with each other. That does make a difference, because when you can be put at ease when you go through something like this, it really does make a difference. And I feel that just their caring nature and just the atmosphere in here really helped a lot in itself. So I'm very thankful for that. When I came in and sat down with Dr. Newman, we went through also the pricing of everything, which I thought was really great, that he showed me up front just exactly how much everything would cost. And I thought that was really great, that they just don't hit you up once they've signed you up. They let you know well in advance, right on the first day, just how much everything is going to be. And you have options. You can either pay it off at that, at that time when you come in, or you can make payments, which I have chosen to do. And so it really eases the burden, because it's not cheap, but I feel that it's been the best thing I've ever done for myself. So if I spend some money, I know it's for a good cause. It's for me to have a good life, and my family's better off from it because they don't have to listen to me complain. So it was worth it for sure. And I'll go without other things if I have to, but I don't have to. But I'm glad that I did it for sure. I live in a retirement community, and so there's a lot of older people that have what I have. And so whenever possible, I really try to put the word out there about regenerative medicine, because there is an alternative to surgery. And I know a lot of people that are older, they're very concerned about having surgery of any kind. And you don't have to put yourself through that. So I'm always out there trying to spread the word. And when I have my braces on, they come up to me and ask me all about it. So I have given their name to a few people, and I'm out there pushing this as much as I can because of how much it helped me. I know it could help them, and they don't have to live in